Ever since childhood, we have been taught that the pursuit of happiness is the chase of a lifetime. I'm Terry Bradshaw, and I've learned that true success is not so much about what you achieve, but how you achieve it. Join me as we span the globe, meeting the people working hard to attain their own net worth. In order to minimize out-of-pocket expenses, patients with health insurance often seek providers who are considered in-network on their health plans. To achieve in-network designation and receive reimbursement for services provided, physicians and healthcare centers must be credentialed by the various insurance companies. It's something that ophthalmologist Dr. Relief Jones III knows well.
From the moment a physician opens an office, there's a tremendous amount of overhead that must be covered. The most efficient way to get revenues flowing into the practice is to get contracts with government and commercial insurance providers. Patients are much more likely to come to your office if you're in network with their insurance company.
For many health professionals, credentialing is a time-consuming, complex process. It's ongoing and has to be repeated every 2 years from the effective dates of the contracts. Like a growing number of physicians today, Dr. Jones outsources his contracting and credentialing functions in order to focus his time on providing care to patients. Based in Granbury, Texas, Nationwide Credentialing provides credentialing and contract management services to physicians, ambulatory surgery centers, urgent care facilities, and durable medical equipment facilities across the U.S.
There's three main components in order to have a successful practice: the expertise of the physicians, contracting and credentialing, and billing and collections. The biggest misconception is the time frame and the tedious amount of work that has to be done in order for a physician to be properly credentialed. You can't just sign an application and a contract and expect for the process to be complete.
Experts say it can take anywhere from a minimum of 90 to 180 days from the time the insurance company receives the provider's information to complete the credentialing process.
Once the application is received by the insurance companies, it's checked to make sure that all required documentation is attached. It then goes to primary source for verification, approval by the board before it can be loaded with an effective date. This is on a perfect application, and any changes or mistakes only serve to delay the process.
Adding to the complexities of the credentialing process are several other challenges.
The regulatory environment is continually shifting, brought on by changes from Medicare and Medicaid. Also, the purchases and acquisitions of managed healthcare companies and negotiation of the contracts with the health plans. Reimbursement rates are set by Medicare, and Nationwide continues to stay on top of these changes and to negotiate better rates for our clients.
Nationwide works as a liaison between the healthcare providers and the health plans. This allows physicians and their employees the ability to focus on delivering patient care and running their practice. Another advantage of outsourcing to companies like Nationwide is that they have the knowledge and experience in dealing with the many nuances of the credentialing process.
You must have a tax ID number, a physical office location, and hospital privileges. If you are currently credentialed in a group practice and decide you want to go into private practice, you can't just change your tax ID number and automatically be credentialed and in network. A change of tax ID means a totally new contract and credentialing process must occur.
For Dr. Jones, outsourcing his contracting and credentialing needs has proven extremely beneficial. He attributes part of his practice's success to proper credentialing and exceptional contract management.
We could do the credentialing and contract management in-house, but it's a detailed and time-consuming process. It's simply more cost-effective to outsource this function. Nationwide Credentialing fulfills our credentialing and contract management needs, allowing our doctors to focus on patient care.